All right, how you guys doing today? It's Anthony Gangi. Welcome to another episode of Tier Talk. Today we have definitely a needed topic, ACOIN as well as One Voice. So we have Andy Potter from One Voice and the president of ACOIN, Brian Daw, here, along with my other experts who will introduce themselves shortly. We're going to be talking about pretty much how do we protect our front line during this crisis, during the coronavirus crisis, the COVID. Basically, we do have some frontline warriors who unfortunately have left us during this battle, and now the question is, are we protecting them? Are we doing enough? And this is what our panel discussion is going to be. So I'm going to have everybody introduce themselves real quick, then we'll go to our sponsor, and then when we come back, we're going to dive into what's the best way to protect our frontline warriors so they can feel motivated to do a very hard job at this point. It's just an unseen threat, and for everybody out there stepping up, hats off. I just appreciate you. It's scary. I know it firsthand how scary it is. And again, thank you guys for what you're doing. I'm living it as well. So it takes a toll. All right, Russ, you mind introducing yourself first, and we'll go down the line?
Not at all, Anthony. My name's Russ Hamilton. I have 27 years with California Department of Corrections and Rehabilitation. And I started way back in 1989 at San Quentin State Prison. Finished up my career and retired. Came out of retirement to do another few years at a small juvenile detention lockup in Northern California. And the rest of my time is spent on Keepers of Chaos, that's Chaos with a K, on Facebook, where I provide content, history, and training for anyone that's involved in corrections.
All right. Hey, thank you, Russ, as always. Hey, Greg, you have to, another shot, introduce yourself again. We do it every show.
Absolutely. Greg Piper, Director of Training for Guardian RFID. We provide training and inmate management tools to correctional facilities all across the country. I've been in corrections, give or take, about 15 years. I've visited about 200 plus jails across this country, whether it be a 4-bed jail in Nebraska or a 4,000-bed jail in Texas and everywhere in between. And I have an absolute passion for corrections and love every one of the professionals out there that's watching. And I look forward to addressing this topic this evening.
It's always a pleasure having you, Greg. And guys, just again, Guardian RFID, they're one of my sponsors. They're a very big fan of what we do in corrections. They actually kind of coined the term warrior because they know that's what we are, that's what we do. And they're very supportive of me and the mission I'm trying to carry out. So it's an honor to be associated with them. It's obviously an honor to have our boy Greg Piper, who is in the field almost every day, visiting all these different jails, making sure staff is safe and secured. So hats off to you as well, Greg. Thank you for what you do. Connie, my medical professional, the non-custody person. How are you in the middle of this?
Hi, my name is Connie Aline. I am the president and founder of the Civilian Corrections Academy, pretty much trying to make sure civilians are out there being safe and doing what they need to do to be a support to custody. This is always just an exciting time, but I know, Anthony, you always tell me you want me to talk about why I'm essential here sometimes. So I have my master's in public health, and as a public health practitioner during this time of COVID, it certainly, is relevant on how we protect ourselves and how we protect the staff. So I look forward to talking about it today.
Thank you, Connie. Always a pleasure having you. And Connie, I'm sorry I was sidetracked because I'm looking for the questions in the articles. You did mention your Civilian Correction Academy?
Yes, I did.
Okay, I just want to make sure because it's training that's well needed, and maybe it's something later on. If you talk to Andy Potter from One Voice, I think it's something that you guys may want to connect with because Andy Potter is very big on making sure good information gets out to the people so they could do their job, and you definitely have great information. So it'd be a good source for you. Hey, Brian, my man, the rebel, the frontline warrior. Brian, it's good to have you. He is the president, I believe, right, of American Correctional Officer Intelligence Network?
I've been called worse. No, I'm the executive director and the founder.
Okay. Yeah. So, Brian, you mind introducing yourself? Because you have your career is very long, but you've been fighting for the front line since day one, man, and you're still involved, and I believe you're retired now, correct? But still fighting?
Oh, I'll never retire. There's too much to do. I may not be on the front lines anymore. I'm too old for that, but most certainly I won't retire. We have a big, big fight ahead of us, and we need to get together as a nation of correctional officers and professionals and meet the challenges we got ahead. I started my career in 1982 as a state correctional officer in Massachusetts. In 1988, I became one of the co-founders of the union up there, the Massachusetts Correctional Officers Federated Union, and I served for 9 years on the executive board. And during that period of time, I was very fortunate to start connecting with different officers all around the country, running various unions, primarily to find out what they were doing well, what they weren't doing well, what worked, what didn't. And what evolved from that is the American Correctional Officers Intelligence Network, and what we are totally geared for is finding best practices throughout the industry and sharing them with our brothers and sisters on the line, making sure that when something new that comes out that's working, that we get the word out there, whether it's equipment-based, whether it's physical safety-based, whether it's PTSD-based, and we're really heavily into that right now, working very strong with One Voice on a couple of initiatives. And there's a lot to do. So I'm honored to be here tonight with such an esteemed group, such a great panel. Thanks for having me.
Always a pleasure, by the way. I got a chance to hang out with you guys in Oklahoma, and man, you guys are definitely leading the way in a lot of stuff. But the cool thing is that I think you are one of the first groups, next to One Voice, obviously, as well, that's bringing a national consistency. One of the problems with corrections is obviously we're very independent of each other. Like, you may have practices in New York that work very well that should actually be, probably practiced by other states or other agencies, but for some reason, there's just no consistency like you would find with other law enforcement agencies. So I think ACOIN, by being able to talk to these different facilities, the people that work the front line from all these different states, you guys are bringing about the consistency from higher level practices that have been known to lead the way in safety and security. So that's very commendable.
Anthony, one of the things I'd like to add with that is what's so important is we work with a lot of the bigger unions in the country that represent a lot of the COs. But there are so many unions in this country, there are so many officers in this country that don't have any representation. We're really the only voice out there. One Voice and us, ACOIN, are really the only lifeline for a lot of these men and women that are in these facilities that don't have a real union lifeline, someone to help them negotiate, someone to work with them on public safety issues and keeping themselves and their brother and sister officers safe. So it's critical that we utilize this umbrella approach to bringing in the professionals within our profession, getting the best practices and filtering them out throughout the country. We're all in this together. We're all doing the same job. We should have the same protections. We should have the same outreach. We should have the same network that we can connect with and we can get stronger from.
And that's amazing that you're doing that, because even like Russ with Keepers of Chaos on Facebook, myself with the venue I have, Greg Piper just going around and, going to different facilities, and just from his experience of seeing the best and worst, trying to bring the best to each facility. Connie, knowing that there was a lack of civilian training, and just saying, you know what, there's a gap here. I know what's needed to jump up and do that. And the One Voice, which is like, hey, it's not just correctional officers, it's nurses, it's inmates. Everybody, in order for us to survive, we technically all want the same thing. It's not a us versus them. So this is an approach that not a lot of people know exists. So it's great to have a venue like this. We put it out there. If you want the information, it's there. But the key is we're doing what we can. Now, before I go to Andy, if somebody wanted to connect with ACOIN, what's your contact information? How would they do that? I think you're muted. You're muted, Bri. Happens.
Sorry about that. You can connect to us on our Facebook page. The best way really is ACOIN2007@gmail. That's the easiest way to reach me. You'll get directly to me, and we turn around our calls pretty much within 24 hours.
Yeah, I know. I call you all the time, and you always get right back to me. So thank you. And I'll be honest, you guys, I never look at my clock. If I just get a thought to call people, I just call them. Ask Russ. I don't respect California time from Jersey. I just don't. It just is what it is. Hey, Andy, all right, so again, I got a chance to meet with some people from One Voice when I was out in Oklahoma. I thought it was a tremendous initiative, because when we were going over these questions that basically were about concerns, it was great to see that we shared a lot of the concerns with not just other frontline professionals like civilians and volunteers, but we also share it with the inmate population. Again, that's not dialogue that's happening on a higher level. So you guys saw that and pushed on it. I think it's making the system a lot better. But Andy, can you tell me a little bit about yourself? And if somebody wanted to connect with One Voice, what are ways that they can do that?
Yeah, so my name's Andy Potter, and I started in corrections in 1989, January of 89. I retired after about 28 years, and now I'm the executive director for Michigan Corrections Organization, the executive director for One Voice, and also the founder of One Voice. As Brian said, we work really close together on a lot of these issues. And the one thing One Voice is trying to really do is figure out a way where we can strategically partner and align ourselves with as many strategic partners as we can. The goal is to bring these stakeholders all to the same table instead of having our jobs change and shape before our eyes. We want to have these officers have a seat at that table, and the ripple of criminal justice reform and everything else shouldn't be passing them by. They should be a part of that. They should be the consultants, the real consultants, and take their rightful spot at that table and help determine what happens to their jobs and how that looks and how it's shaped over the next 10 years. And I think we should have a vested interest. But the only way we're going to do that, Tony, is that if all of us come together as an industry and say, wait a minute, stop the train for just a second, because it seems to be left the station without us in it. And we need to make sure that all of us come together and make one push, one voice, instead of trying to tackle this state by state. It really does behoove us to all of us to connect and to join forces and to really move in those areas that make sense. Now, we're not going to be able to strategically partner with everybody every time. And we're not going to just stand around and hold hands with prisoner advocates. That's not the point. The point is we shouldn't let anybody shape our jobs or shape what they look like without us at the table. So that's what One Voice does, among a lot of things. But right now, our interest is really about COVID and how do we protect our officers? How do we make sure they have what they need in the front lines and make sure that they can go home to their families safely? So that's what we're about right now. So I appreciate you having me on. And right now, the best way to get a hold of me is just my email. It's andy@mco-seiu.org. That's the best way to connect, and because that's what I'm doing right now. My focus is really on my local and what we got going on across the nation in order to bring those voices together. Because there's a lot of states, as we're finding. Brian and I just put out national surveys and did follow-up. As you know, we also put out the resolution, a national resolution that said this is the bottom line on how corrections staff, everybody on the front line, all correction staff should be treated from day one. That's the floor. We think the ceiling should be much higher than it is, but that's for all of us to determine. That's for all of us to decide.
I will tell you something, Andy, as you're talking, by the way, 100% on the point you're making. I love that plaque behind you, that MCO plaque. If you ever have an extra one,
yeah,
that's a beautiful plaque.
I'll try to get you something.
Yeah, I would love. I would post it up, man. Hey, before we go to a sponsor, Connie, from the civilian perspective, what's your thoughts on what Andy is trying to do, but also what Andy has accomplished?
I think it's great from a civilian perspective. I mean, I think it always matters when you can get your voice at the table, because the reality is that oftentimes you have people making decisions who've never worked in the facility, and they don't really know what it looks like when they come up with these great ideas and they want to implement it. They don't understand how it compromises safety and security oftentimes. And I also feel that, it would be great to have a civilian voice in there if you don't have one already, just because the way things impact medical or mental health or just any other civilian staff, it may be totally different because we see things different and we see the inmate from a different perspective. And I think, honestly, being able to benefit from the civilian voices, I think, as well as, the intelligence they bring to the table, I think it only makes it a much better solution for everybody.
Well, when we're done, if it's okay with you guys could obviously exchange information. I think that would be beneficial for both parties. All right, guys. So what we're going to do is we're going to go to our sponsor. Guys, if you haven't, the show Tier Talks for you, brave men and women who work in corrections. So please subscribe, interact, engage, comment, hit that bell. The bell's going to notify you every time I post a video. We're going to go to our sponsor. We come back. Great round table. We're going to be discussing how to protect our frontline warriors. Stand by.
I wanted to attend a university that had an intelligence program. I wanted to look at problems different. I wanted to increase my critical thinking abilities. AMU offered those avenues to expand. Obtaining your degree as an adult, you're actually paying yourself and investing in yourself. You can't put a dollar on it. It's priceless. It's something that can never be taken away from you.
American Military University. Learn from the leader.
Inmate manipulation is a course that is highly needed. It's the process that's so slow moving and subtle that you don't realize it's happening. When inmates choose to manipulate, they manipulate our need to react. Situational awareness and insight is going to save your career. It's going to save you from doing foolish things. Listen to your gut. So the more insight we have, the more we can recognize what isn't so overt, and we can correct our behavior before we fall into a trap that we can't get out of. If you allow an inmate to pull you out of your prescribed role, you are opening up a door for a host of problems. Inmate manipulation, the psychology behind inmate manipulation. Available now. Link in description. All right, guys, we're back. So real quick, before we go into this topic, I wanted to do a little bit of an icebreaker. So I do get requests. Sometimes people will send me questions, and I wish they can come on, but the department probably doesn't allow it. So what they'll do is they'll send me questions like, hey, Gangi, can you give it to your panel? Or, can you give this question to Russ? Or can you give this to Connie? And, I thought I could answer this question for them first. So what I'll do is I'll ask it, and then we can go around answer it as a panel, and then we'll go right back and kind of get to the topic, so it's just a little bit of an icebreaker. So real quick, I can't say who it comes from, but good afternoon, Mr. Gangi. I'm a fan of your YouTube channel, Tier Talk. I'm a correctional officer employed by the state of South Carolina. I have been serving for 2 years. My question to you is this. I'm deathly scared to promote to the next rank because I have a great spot in my department as outside grounds maintenance and horticulture officer. I work 8 hours a day instead of 12. It's better for my family. See, if I promote, it probably will not be on the 8-hour shift. I'll probably go back to 12, which is terrible on my physical health and family life. I don't know what to do. Any advice? So I thought we can go with Russ first and then work it down the line, but I'm sure everybody would have some advice to give this warrior. So Russ, would you like to go first? Russ, you there? I don't know if he's there. Russ, can you hear us? Greg, you want to go first?
Why not? Russ seems to be frozen in time, so we'll come back to him. There, he looks like he's back. Anyway.
Okay, Russ, we're going to come back to you, Russ. Hold on. You were frozen. I was worried, but all right, so hold on. We'll go to Greg, then we'll go to you, Russ.
Well, I want to just say, first off, that your decision to support and do what's best for your family is absolutely the right thing. Do what's best for your family always. But there's one caveat to that, and I know we all have an opinion, so I'm just going to have one point to this, and it's this. If you choose not to promote, you can't complain about your supervisors in the future. Because if you're not willing to promote and get yourself in that position of authority, then you can't complain about who they promote because you're not going to put your name in that hat. So absolutely, do what's best for your family. But my one piece is you can't complain then about the people that they do promote and whether or not they're good supervisors because you weren't willing to put your name out there and see if you can help the facility.
It's very powerful because I actually was talking to Russ the other day and I said, when you get promoted, be the change, don't be changed. You know what I mean? Like bring that roots with you to the top and try to make a difference. But if you're not willing to step up and make a difference, well, don't be that one of those people that complain about what's happening. Go there, make a difference. You can still have an impact. Look at me. I'm on the administrative level, but I've never forgotten my roots. And I think my roots is what made me a better manager, because I love my people. I really do. Okay, Russ, you there? Just wave so I know you're not frozen. Russ, were you able to hear the question?
Yeah, I did hear the question, and I had seen it earlier as well.
So what's your answer, Russ?
My answer is just simply you have to look at what your end game is and what you're looking to accomplish. What this guy sounds like is that everything's good on a day-to-day basis because he's enjoying the job that he's doing. Well, that's fine for right now, but what do you want your final impact in corrections and so forth to be? There's nothing wrong with enjoying the job that you're currently in and taking that and living through it. But if there's something else there, if there's something else that you want to accomplish, if there's some other goal that you need to get to, then that's not the way to do it. You have to start thinking about those other avenues that you're going to pursue if that's just not for you. So I would just say that, you got to figure out what that end game is, and then you got to implement a game plan. And if it's good enough for you to just, live through that and be on the day-to-day shift in that one position, that's fine. But you don't want to get to the end of your career and go, damn, I should have done something else.
I kind of agree with you. I guess I'll give my thought real quick before I go to Connie, and then we'll go to Brian and Andy, because I'm going to kind of feed off what you said. When I was looking to get into the administrative level, I knew I had to go back to school, and I actually went back to school when my wife was pregnant with our first child in 2012. And that wasn't something that was easily agreeable with the wife, because school obviously took a lot of my time. But with that said, this was a career for me. I knew going in, this was going to be more than a job. This was going to be a career. And to me, part of a career is looking to see if there's opportunities to move up. And sometimes opportunities come at the craziest of times. They really do. They don't care about your life. This is the opportunity. So what I did was eventually I was able to give my wife an understanding, and then basically figure out the new routine of life. Because believe it or not, it's strange at first because it's new, but eventually somehow it's just the magic happens. You get used to that new routine, so thank God I did get used to that new routine. And look at us now. I'm 8 to 4, Monday through Fridays, well, still hours now, obviously, but on a standard schedule, Monday through Fridays, 8 to 4, and really happy that I made the decision. Was there a bit of a sacrifice? There's always going to be a bit of a sacrifice. There's nothing easy about any of the choices that we have to make in this profession. But in the long run, when you make this a career and you go to retire, these sacrifices will matter. Because again, hopefully I get to retire with a little bit more money in my pocket. All right, Connie, so what's your thoughts?
So, the first thing I thought of was comfort, right? So even though you have the comfort of a pretty simple schedule and being able to go home to your family, the reality is that if you stay on the perimeter, you're probably going to always be on the perimeter. And when things are happening in the facility, what I've found in my career is that it's all about the relationships. When situations happen and people see you get involved, they see you doing things, you now have established relationships with folks who can see what potential you have. When you're outside, nobody's really able to see what you bring to the table and can really encourage you and support you as you want to climb the ladder, whichever way it goes. So, I would just say, just understand that staying in that schedule is a choice that you're making that will impact your career for the rest of your time there.
That's very, very well said. I agree. I've seen a lot of people actually get upset because, they wind up blaming their family for not moving up. So again, are you going to hold your family responsible if you had the opportunity? Now you're going to go back, or you're going to say, well, I could have done it if I didn't have kids, or I could have done it, but my wife wasn't, that could definitely put a strain. So having that balance really does matter, and definitely making sure that when you make the choice, it's not the pressure from the outside that made you make that choice, that you took it internally and made it your own. Brian, what's your thoughts on that?
Well, I got a different take. I'm the old guard. And the young officer has 2 years on the job. I don't think he's ready to promote. I think he should stay where he is for a little while longer, get some more experience, enjoy the time with his family while he can as they adjust to his new life on the job. We all know a lot of people jump out of this job within the first 5 years. And there's a lot of reasons for that. And I think the young man has identified a couple of issues with the fact that he's worried about the stress level on his family, and that's really smart. And one of the things I hope he does remember is, no matter how long he's in this career, corrections is not who you are, it's what you do. Be true to yourself, be true to your family, that comes first. But with only 2 years on the job, I'd tell him to hold off a little bit longer. He'll have time to make that change when he gets his feet a little bit wet, a little bit more solid, I should say. And he knows a little bit more about the job.
Brian, even when I met in Oklahoma, and when I had you on the show when we were doing that gun for hire range, you have a way to talking to people's heart. Like the way you say things, it's powerful, because you're right. You're 100% correct, but you have a way to really resonate with people. You're 100% correct. I agree with you, obviously. All right, Andy, what's your thoughts?
Yeah, I agree with a little bit of everything that was said. I'm kind of old school. I'm with Brian a little bit on this. I've always told people, get at least 5 years in before you promote. But that's not always the case. And really at the end of the day, they got to follow their heart. They got to follow their home life, what their lifestyle brings them to this. If they want to move into this, I've always said to officers, I chose to be an officer on afternoons, 2 to 10 shift for many, many years because that suited my lifestyle. And I liked being a corrections officer. It wasn't that I didn't want to promote or anything. I just liked being a corrections officer. But we need good supervisors as well as we need good officers too. So I always tell people, look, like you, Tony, if you're going to promote, bring everything with you. Don't forget about the things you learn from the folks you work side by side with every single day. Those are the folks that are going to make you a successful leader when you promote as well. So I agree with pretty much everything that everybody said.
And I also say, if you're also going to promote, I would also recommend a change of location, because I think in order for you to see yourself as a supervisor, you should put yourself in a facility where they only know you as a supervisor. Sometimes it's a lot harder when you promote into a facility that you know them as your boys, as your fan, and then all of a sudden when you get promoted, they really haven't seen you as a supervisor. They still see you as, our boys, and it doesn't give you a chance to take on that persona. Now, when you go to another facility, they only see you as a supervisor. You adopt the persona a lot quicker. And if you, by any chance, people transfer in that were from your older facility, they'll start following in line with, the officers that now see you as a supervisor. So it really helps with that adjustment. All right, guys. So that's the icebreaker. I think that was great dialogue. Hopefully he gets something from it. I'm sure he'll share it. But let's go right with the main topic. So Brian reached out to me, along with also Andy, and they are very concerned about what's going on with the frontline warriors that are working through this coronavirus pandemic, COVID-19. Now, obviously, I'm living with it right now. I'm going through it. It is a scary situation, but the question that Brian asked, and it's pretty much what got my attention, besides the fact that he gave a tribute to, at that time, was 12 officers who have fallen from COVID. I believe the number now may be 13 or 14 of what we know of. Again, there could be some states that we don't have the information, but from the information that was given to us, that was collected by Brian, I think it's 13. But having said that, Brian asked a great question, and it's definitely worth exploring again, because obviously as we evolve, and Connie's also going to touch on some practices that are being done now, including testing the antibodies and just basically ways to make sure we do what we can to prevent this threat from coming into the facility. Again, as best we can are we doing enough to protect the officers or to protect the front line? Are we following those CDC guidelines? And, if so, what are we doing that's working? What are we doing that's not working? And let's have that discussion. So, Brian, right off the bat, let's talk about why this is a concern for you.
Well, obviously, in our profession, we work in a situation that we have the highest risk population there is in the world next to working inside of a hospital. Beyond mental health workers and healthcare professionals, no one has to deal with a population that has such a high risk as we do. Whether it's you're dealing with communicable disease, infectious disease, we deal with MRSA, TB, HIV, all at much accelerated levels than the general population does. So quite naturally, we're already in a compromised situation. Then you put on top of that our stress levels. When you look at custody staff having a PTSD level of 34%, well, one of the things that any doctor will tell you is one of the things high stress will do, it'll compromise your immune system. And what is the COVID attack? Your immune system. So now we're in a double bind. First of all, we're dealing with one of the most dangerous population and high-risk populations. And then secondarily, ourselves, we're already in a weakened position, most of us, many of us, going in. So it became obvious to me that we need to take a quick look at what was going on as soon as this started to raise its head. I got in touch with Andy, who I work with very closely now, both of our organizations do. We said, we have to find out what is going on out there. And much to my very shock and surprise, was knowing that we deal with these issues as we do, hepatitis and TB and MRSA, I thought we would be much better prepared at our facilities. I thought we would have the face masks. I thought we would have the hand sanitizer. I thought we would have the gloves. I thought facilities, that would be second nature. And I was shocked to find out that wasn't the case. And to be quite honest with you, that scared the heck out of us. Because we know it was coming. You could see it was coming. We could hear it was coming. in a confined area like we are, in the spaces that we are, if it gets inside of one of those prisons, one of those jails, it's going to be impossible to contain. But what we do know is the opposite's true too. If it's not in there now, we should be able to make sure it doesn't get in there. We should be able to take the precautions necessary to make sure it never enters that facility. And that's what sparked me and Andy on this crusade, to find out what's going on around the country, start advocating to make sure that we have a bottom line minimum set of standards that every facility in the country should be up hearing, and make sure we get out there. We went and contacted the National Governors Association. We put together a resolution with 15 points that we feel have to be met. And we've kept in touch with officers all across the country. Just on this one issue in 24 hours, I had 72,000 hits on my Facebook page. I mean, this thing, people are very concerned about this. And the survey we just held over the 15th and 16th of this month, just the last 2 days, some of the comments back from the officers are heartbreaking. They're not seeing their families. They're afraid to see their parents. They won't go home to their children. These are the men and women that every day are putting their lives on the line for the public. And they risk it in some of the most incredible environments there are in the world. And now we have to deal with this. And we need the help and support of all the officers across this country. We need the help and support of our governors. We need help and support of our president. We need to get this out into the media and let people know we are the second most potentially damaged front line there is in the country. We face it. We face this problem pretty much more than anybody else except for healthcare professionals. And something has to be done. And through our networks, through One Voice, reaching out through their groups, and through ACOIN and reaching out to our groups, we put together a pretty strong coalition in the last week. As a matter of fact, tomorrow we're having a roundtable discussion with some of the leaders in the nation on this very topic and what's being done, what has to be done, what isn't working, what is working, and we got to make sure that we get this right. Because once it gets into one of our facilities, it's deadly, as we all know. We've lost 13 officers already, and Lord knows how many others have been affected.
Well, you know what's interesting. First of all, Brian, thank you for your dedication right now, because I'm keeping up with your post on Facebook as well. And when you obviously mentioned for the need for this dialogue, it has to get out there, because I think that the states that are going through it right now, or the agencies that are going through it right now, they're making a tremendous sacrifice. But with that sacrifice comes ways that you can learn to fight off this invisible threat. So don't let our sacrifices go to waste. You know, we have fallen officers that have made the ultimate sacrifice, but if we're not learning from those fallen officers, you know, or those fallen medical professionals, the fallen frontline warriors, then their sacrifice goes in vain. You know, it's now, Andy, you have the One Voice. So you're a collection of voices that go beyond the correctional officers that are, you know, representative of believe it or not, it's the medical staff, it's the people running programs, it's inmate advocates. I mean, what are some of the concerns that kind of are basically the same as the COs? What's the big generalized worry here?
Look, first I just want to say there has been some lives lost. And for me, I grew up in this industry. I grew up as a corrections officer, and we've lost some in Michigan too. And I grew up with some of these people that are really sick. We've got almost 200 that are pretty sick right now, corrections officers. We've got another 100 that are just in quarantine. And we've got over 500 inmates that are sick. You know, I just talked to an officer last night about 3 a.m. that called me and just broke down and said, look, I'm done. I walked out of there, Andy, and it's like, I'm no longer in a prison. It's like I'm in a hospital in some kind of a, like, you know, he just was done. He's spent. So, I mean, my heart really breaks for these guys. That's why it's so important, like Brian said. So the N95 masks, for instance, this is just an example, right? We talked about this last time I was on your show, about whether or not we should wear them, whether or not that's going to be disruptive, whether or not it's going to, you know, think about, that was just, what was that, 2 weeks ago or something, Anthony? I mean, think about what we were talking about and how we were talking about it. I bet you the conversation would be different now, because I'd be telling everybody, wear those damn masks. Those N95s are as important for us as it is those inmates. And I'll tell you why, because it doesn't just hold it in, it keeps it from getting in. So there's two ways to look at this, and there's two stakeholders here that are going to be damaged the most. Those that we watch over and us. And if folks aren't given if they're not caring at all about those that are in there, which, look, I get it. I understand. I grew up in a rough neighborhood. A lot of my family and friends went to prison. I understand both sides of this. I've seen pain on both sides, but those officers should have those N95 masks. That's a must. We put that in our resolution. That should be ground floor. It's just as important as if a nurse or somebody else has an N95. You know, they've done a really good job promoting the healthcare, the first responders in the streets, the firemen and the police, and they've done a good job across America getting that voice out, telling their stories. We just don't like to tell our stories. We're just not like that. And we got to change that. We got to start telling these stories, and we got to start telling them in a way that says, look, it's not just in our best interest. We took an oath. It's for everyone's interest here to make sure that we have the minimum of what it takes to stay safe. Not just us, those we watch over, and the maintenance, the healthcare, the food service, all of them are on that front line with us. We can't forget that.
You know, that first off, Andy, that's so well said. I think in the end, people are, if they're willing to listen and politics just steps away for a second, in the wake of this all, people are going to have a real newfound respect for what we do. The funny thing is that this problem should be aired more nationally, and it's not. It's kind of like glazed over. And that's because I don't think people want to give the recognition to these dedicated workers, because they don't want to show how good it is that we do our job, because they painted a picture of how horrible we are at what we do. And now, unfortunately, when we're making these sacrifices, there's no one really stepping up saying, hey, guys, let's not forget about these brave men and women working in that prison that are trapped with it, that can't self-quarantine, that can't run away from it, that just have to face it unknown, and they're scared. They're scared, but for us in corrections on all levels, being afraid motivates us. That's what makes us different. You know, fear is a motivation for us. It doesn't make us hesitant, but are we afraid? Yeah. I've had to talk to people that were crying over the phone, but guess what? They're crying over the phone inside a unit that they're working in. You know, they're stepping up. So, I mean, for people that want to pass judgment or whatever it is, I just wish for once they would just get out of their own heads and just see what it is that we do. And if ever there was a time to do it, this is now. Because the lives right now, we're responsible for those lives. And the funny thing is that the front line right now is only going in to protect the population. They're not going in to protect themselves. Their sole dedication right now is to protect the population. That's why they're in there. You know, so for people not to recognize that, now I want to go to Greg and then Connie, then Russ, but Greg, you know, he kind of goes to a lot of different facilities, a lot of jails, prisons across the country. His knowledge of just different procedures has got to be amazing by now. But I'm just curious to know, through your contacts and just kind of like a general understanding, you know, what are their concerns and fears just on a bigger level?
Well, the main reason that most of your county facilities are not going to have the PPE that they need, it comes down to one thing. It's money. They have not put the resources, they have not put the finances into these things. I've been to facilities where the most extensive piece of safety equipment they have is a fire extinguisher that's 18 months or 2 years out of date. I'm not exaggerating. I've been to facilities where the radio system doesn't work, the control panels don't work. So you're talking about there's county jails, 3,500 of them across the country, and many of them just don't have the resources. So what's the answer to that? Well, I'm going to go back to the theory that I've used all along, and it's gotten me much smaller waist size over the years. It's better to ask forgiveness than permission. These jail administrators need to just go out and spend their money and buy the stuff. I don't care what the county commissioners say. I don't care what yes, I do care what the sheriff says, but I don't care what the county commissioners say if there's no money in the budget. Spend the money. We'll figure it out after the fact. But Tony, you were so passionate about it, and I'm 100% on board with this. We're not serving their needs by trying to find money. No, spend whatever money's necessary on this stuff, because people are going to die. Plain and simple.
And that obviously well said. I can't argue that, Greg. You know, I like that thought. I don't know if people actually thought of that before, but why wait for the yes? Just do what you got to do and then deal with whatever discipline. Because at the end of the day, I guarantee you no one's going to sign off that discipline, you know, because they would look foolish. You know, you went and bought equipment to save lives. Who's going to discipline you for that? Oh, okay, hold on. I was going to go to Connie first, then you. Is that all right? Or Hey, Kai, I want to ask you something because I want to hear a little bit from the medical side of corrections. What are some of their greatest concerns in regards to dealing with this threat? And do those concerns also mimic the concerns of our correctional officers and other essential staff like food service, maintenance, mental health?
Yeah, absolutely. I mean, the biggest concern is not having the available equipment and safety protection. They just don't have it. And what I've heard from many nurses and doctors is that they're also, from whoever their reporting body is, they're also getting sort of in trouble for sharing what they have with custody. Like, this is specifically purchased by this vendor for this purpose. And so the fact that you have civilian staff in there who's trying to like do the right thing, but being told that that's not what they should be doing. That's not what it was purchased for. It's supposed to be for the nursing staff, excuse me, to protect themselves and such. And I feel like, you know, our reality is that anyone carrying the virus, anyone positive is going to get someone else sick. So like, if we're doing our best to try to sort of halt the disease transmission, like I just can't imagine that I'm going to get called into my supervisor's office because I gave an extra box of gloves to the officer in the unit. You know, so I think one of the big things from a nursing medical perspective has been, I think we're trying to be supportive because we understand in many facilities there is a shortage of available protective equipment, and we're trying to share it so that we're protecting everybody. And that's not necessarily being supported by those who control the dollars.
And I'll tell you something, from what I got, just a summary of what you said would make a great t-shirt. I know we're professionals, but we're also human.
Yep.
You know, humanity is in this profession. It defines this profession. How dare you try to make it where the professional, yeah, we're professionals, don't get me wrong, but if I saw an officer, even if I was an officer and I saw someone that needed something, I would give them my supply. I would take the charge because I know I can live with that charge as opposed to living with the responsibility that I could have done something to help that person. Now, before I go to Russ, Andy, you had a comment with what Greg said because I saw you raise your hand.
Yes, I just wanted to go back to something Greg said because it made total sense. And by the way, a lot of what we're dealing with, all of us are dealing with, are issues that were there already that we've been trying to raise to the surface, right? Overcrowding, understaffing. That's a big issue, especially when it comes to how some of these facilities are designed with open bay settings and the ventilation systems as bad as they are and outdated the way they are. But I wanted to touch on something Greg said because it made sense. Look, you got to use resources when you have them. If you don't use them when you have them, right, people tend to want to hunker down and protect that stuff and protect their resources and things like that. You can't wait until tragedies like this to start using those resources. But we went out and we bought masks for our officers ourselves because the masks that they were offering, and look, at least they were trying to offer something as far as a cover goes. It wasn't N95, but it was something. But it wasn't comfortable. It wasn't what they needed. It wasn't durable, didn't hold up. It got wet. So we went out and commissioned someone to make some outdoor weather. They do outdoor weather clothing. So we did exactly what Greg said. Use those resources. Go out, get your guys something that's going to make sense, that's going to fit comfortably so they can do their shift, so they can do the work, so they can come in, feel a little bit better about that.
Well, I'll tell you something. Obviously, a lot of states or a lot of agencies have evolved in what, you know, even my thought has changed. I mean, at one point, I was against inmates wearing masks. I'll be honest with you, because we had limited resources. And if we had limited resources, you give it to the threat. The threat is staff or inmates that work in sensitive areas. But as resources are starting to come in, now it changes. If we have the resources available, then go ahead and obviously give it to the inmate population. The only reason why I wanted to go to staff first is staff is where the threat could have been. Now, Russ runs a Keepers of Chaos page, and one of the things about Facebook is we have all these groups, but we never seem to take these groups out of Facebook. Like we never have these meetings. I think obviously, I think ACOIN was probably only one of the ones that I realized that, oh crap, we have this Facebook page and we're actually going to go meet in Oklahoma to, you know, let's see who are people that are dedicated to the mission or people that are just kind of just following the page. You know, let's see who the active one are. I mean, I may have, let's say, you know, 40,000 followers on Facebook, but out of the 40,000, maybe only 20 or 30 are really active in the mission. So I think it's always going to be a benefit one day is if we could take groups like Keepers of Chaos, take groups like Correctional Officer Brotherhood, and when this is all done, you know, let's meet. Let's, you know, maybe Guardian RFID, you never know, he's a big fan of corrections. Maybe he'll, you know, help us out with getting a hall so we can meet and just see what we're about, you know, because it's about time we take these Facebook groups and actually start meeting each other, you know, start interacting, because our numbers are huge. They're huge on Facebook, but they would be better if we could meet in person. And who is Brian? Who is Russ? Who's Andy? I see you guys commenting all the time, but who are you? And Russ, now you monitor obviously a very active page, Keepers of Chaos. What are some of the concerns that you're getting from corrections across the nation?
Well, yeah, you know, just being in not just my forum, but all of the forums that I visit, you know, on almost a daily basis now, just trying to keep up with some of the things that's going on. There is unfortunately a real feeling of desperation out there in some of these departments and in some of these facilities. I was just in one today, and it was state level, so not even down at the county level or anything. And they were talking about, you know, they're having to wear, you know, some inmate made masks, and they were so desperate over it that they didn't even want to wear them because they said, well, it won't do any good. And so I was trying to get at them, and I was trying to tell them, look, you know what, if it at least reminds you not to touch your face, it's still better than nothing. But there's just a lot of people that are starting to throw their hands up, and they're starting to maybe make some not so good decisions about some of these things. One thing that I pointed out earlier today too was, you know, I took a little jaunt down to the U.S. Postal Service, and every employee in there had a mask on. They're all being supplied this. Why aren't corrections officers getting that? You know, all of the street cops that I know, and I know a lot of them around here, you know, they're coming up to me, talking to me. All of them have a mask on. So there's a supply somewhere. Where is it all going? How come these masks aren't making it to the places that are considerably more dangerous? That street level cop that, you know, we've got out here in our little cities and towns where I'm at, they're probably not in a whole lot of danger. They should take precautions, but I guarantee that the 3 or 4 prisons that are just, you know, within an hour's drive of where I'm at right now, those correctional officers are facing serious danger doing what they're doing, because they're walking into the midst of that COVID every single shift. So, you know, I would just encourage everyone to, you know, be on that. Make sure that people know that we're not getting what we need. We need to change that in any manner possible.
Well, first off, I agree. The people didn't realize, I think that corrections was like an afterthought. I think a lot of the preventive measures went elsewhere, and all of a sudden, like, oh, wait a second, you know, the prison. But at that point, you know, especially in New York, New Jersey, Florida, you know, we were forced to react. We were forced to scramble because it was novel to us, but I don't think anybody saw it as a threat. We did. The front line did. I'm saying people in the higher level just, it wasn't registering with them, you know, and then now we're scrambling, trying to kind of deal with choices that are inconsistent at best, which shows lack of confidence. So, like, if people keep on changing the rules of the game, then we look less confident to those that we have to give the directives to. So the thing is, we need some consistency. We need some rules to follow. And the CDC has been giving us things that we're supposed to follow. And unfortunately, I feel that some places are finding excuses not to follow them. And then with this release of inmates that are happening on a national level, you're taking the threat now that was inside the prison, and now you're bringing the threat outside the prison. You know, where it's just, it's kind of mind-boggling. And I don't know if Andy or Brian have it in front of you, but do you have those 15 points that we need to meet? Like, do you have that list in front of you so we can take a look at what the points are?
So, yeah, I've got them. Am I muted still, or am I good?
No, I can hear you, Brian.
Okay. No, yeah, I've got them here. We've got the 15 points. I did want to stress something that on the equipment issue. And this is part of the 15 points. As far as face masks go, the survey we just did the other day, 20% of the officers out there right now reporting on this. This came from 91 different facilities all across the country. 2 private, 38 county jails, 47 state prisons, 4 federal joints that responded to this. 20% of the staff have no face masks whatsoever. None. 25% of the staff have no hand sanitizers, nothing to wash their hands with. The only thing we don't fail totally miserably on is disposable gloves. 8% of the staff don't have disposable gloves. But what's really driving a lot of the problems here is a lack of information. People aren't being told why the policies are being implemented as they are. They're not being told where the supplies are and when they'll get there. The inmates are being left out in the cold as well. That causes more tension, more strife between staff and inmates. No one knows what's going on. The reports we got back show that 44% of the officers say there's no staff updates. They're not getting any updates. They're just running it as they always do, paramilitary, do what you're told, that's it. And that's really problematic. And as it comes to the inmates, 60% of the officers say the inmates aren't getting any information. That's critical stuff. So if we're going to keep this place calm, and we have to do that, there's nobody we are the first responders. There's nobody coming in the door behind us. We're in. So if it's not safe in there for us, it's not safe out there for anybody else. And when we start having this additional frictions that we don't need, we need to get the information in the officers' hands, we need to get the information in the inmates' hands, and we need to get the supplies available now. And then we also need to start taking care of the economic concerns of the officers as well that are driving the stress through the roof. Right? What's going to happen with their sick leave? Any of the sick leave utilized should not come out of their accrued time. It should be given to them differently. They should be given hazardous duty pay. And what me and Andy worked on pretty hard was making sure, and this is an unfortunate scenario, but it has to be dealt with, that we're covered under line of duty deaths. All right? Because in March, when the Bureau of Justice Statistics issued their decision on COVID, it was going to be up to the officer's surviving family to prove that the officer got it inside the prison. We went to them, and I'd love to say it was us that caused this, and I certainly won't. But we certainly did go to them, and we raised our concerns about this. And they just released a memo last Friday that changed that. That said, okay, we are going to presume that the staff member did indeed contract COVID-19, and it will be up to the employer to prove otherwise. Now, that's a $365,000 benefit to the family of the survivors. That's nothing when you talk about an officer's life. But at least some knowledge for us as the officers going in there. We know if, God forbid, this is our last day behind these walls, or that it's going to lead to that. And at least there's something there for our families. Something's going to be there. And that's important that our guys know this, that people out there at least care, that every day they go in there, yeah, we care a lot about what they're doing behind those walls. So we need to make sure that they have the equipment, make sure they have the information, and we have to make sure that they have the economic stability to do these jobs. Give these officers hotel accommodations if they're working in facilities where they're exposed to COVID so they don't have to bring it home with their families or scare their families to death as well. Make sure we take these precautions. Just in Massachusetts today, they just issued a memo today. They're hiring back retirees. If you have less than 5 years off, you can come back and work in the state of Massachusetts to help out. Now, you're not going to have a lot of the contact jobs, but you will be able to do some of the other jobs, the towers, some of the other stuff, food preparation, things like that. That can really help out. Because this understaffing crisis is going to hit us too, as we have more and more officers going out under quarantine or going out for whatever reason under COVID itself. Who's going to back that up? Right? So we have a host of issues we've got to deal with, and they're all on the plate together. And it all starts with information and education, not only how we deal with this, but how we have to deal with the inmates and how we keep everybody safe. I'm sorry to keep babbling, but this is
no. Brian, you have, this is no time limit on this show. You got points. We have to get it out there. Everything you said has value. I've never heard one babble from you so far. So you keep it going. We all, this show can run as long as it's got to be. It's about the information, and that's what we're all here for. I want to go to Connie before I go to Andy. But Andy, thank you for sending me what you just sent, because I'm going to look at the points now. But does anybody have a response for Brian real quick? Anybody want to feed off what Brian said? Okay, hey, Connie, are we getting the same benefits for the some of the civilian staff? What about medical? Do they get hazard pay, or how's it working for them? Do you know?
So in some states they do, and in some states they don't. I know that recently there was something where they were giving like nurses some hazardous pay, but it's not consistent. And I know that some of the unions on the nursing side have been really trying to work to make sure that they get the support, because they are literally on the front lines of this when folks show up, whether it's in a facility or when you show up in a hospital. And so I think the struggle is real. I mean, it happens to be in Connecticut that you actually have hazardous duty pay because you work in a facility. So I know that is not what happens in a lot of facilities or in a lot of states for that matter. So they're working on it because it's just not consistent. And how do you just say this life is worth more than that one? You know, if we've identified that there's a vulnerability, I just can't imagine that we're not supporting that vulnerability everywhere.
Right. And as I said, we're also, why we're talking about this, and I'll go with Andy on this one, but we have other employees that may not be considered essential on the streets, but they're essential here. Like I see a lot of people giving a lot of shout outs, and thank God for our grocery workers and stuff like that. But we have food service workers. Mm-hmm. I don't hear them getting shout outs. I don't hear those brave men and women that are coming in every day to make sure the inmates are served their food, or the maintenance workers who are making sure that the cells have running water at bare minimum. I mean, you know, they're considered essential. And I think that when it comes into our world, we need to be able to note that, hey, on the outside, they're essential. On the inside, we can add a little more to that. So do we see the same benefits going to the employees that we deem essential in corrections for the purpose they serve?
I mean, I think across the board, and Brian can add to this as well, because we both worked really hard on a lot of these surveys that have went out. And they don't go out to just corrections officers. They go out to frontline staff. So we've got food service workers that have been hit pretty hard with this coronavirus, as well as anybody else has. And I know a lot of them are frustrated not having the kind of PPEs that they need, being really understaffed and undervalued, like a lot of us have. Anybody that's in public service is really undervalued, if you ask me. I would say this also, Anthony. I give all of you guys, Greg and Russ and Connie, and of course you, Anthony, along with Brian, a lot of credit, because we're all carrying some extra water here. You brought it up earlier. We've got a lot of folks that want to stay connected and want to know what's going on. And Brian touched on this too. A lot of them don't have unions. So a lot of these folks that work inside, they're not covered by a contract. They're not covered by anything. And they get looked at like sometimes they're at the bottom of the barrel. And we've got to do a better job of making sure that we circle wagons for everybody that's in there doing this job right now next to us. We all know we can get ornery. Just corrections officers in general can get pretty salty and meet out at the flagpole or whatever. But hey, when it hits the fan, brother, we lock elbows. And we got to do that with everybody we're in there with right now. We got to carry everybody's water.
Hey, Greg, I see you nodding your head a little bit. You're in agreement with Andy. Anything you want to say?
Well, you know, earlier this week, you and I reviewed a video from Cook County, horrible situation, inmate attacked an officer. And we've seen those before. That's going to happen. But, you know, that led us, that was a lead in from the video we had done the week before that with where we had a riot in Lansing over inmates who were frustrated and angry again about what Brian pointed out, lack of communication. So it's really imperative that that communication come from the top down. Supervisors need to be with their officers doing shift briefings. I know we get shorthanded. We're like, hey, we're not going to have a shift briefing today. Everybody get on shift. No, you need to get out there 15, 20 minutes early, and you need to meet with every member of your team. Let them know what's going on, even if it's nothing. Let them know this is what's happening. We got gloves. We got masks. Watch out for this officer. Is everybody feeling okay? Or, you know, watch out for this inmate, excuse me. And then at the end of the shift, get with your team as well. How did everybody do? How about a little debriefing? We call it a parking lot, if you will. Get together and talk about it. Then inside the walls, find a way to communicate to the offenders. Find that officer who does have good rapport. Send him around to every pod. I don't care if it's the same officer. Have them get out there and have a little chat with the offenders and say, hey, got no information for you, or I got information for you. Let them know what's going on with the news. Let them know what's going on with the facility inside and outside the walls, because lack of information causes frustration and anger, and these are already frustrating circumstances. The inmates only have one way to respond, and that's a riot, or that's a frustration. They're going to lash out, and that causes injury to everybody. So communication must be upheld, and that starts from the top down. People have got to let everybody know. Let them know what's going on with this situation.
And guys, there's a lot of riots happening, a lot of unrest with the population. Again, we saw it in Lansing, but I believe Washington had inmates running out. A lot of places right now, and officers are getting hurt. Frontline staff are getting hurt. I want to pose a question to Russ, and maybe Brian could complement that. And then I have a question for Connie as well. That's kind of on par with what I'm going to ask Russ and Brian. Me and Brian, actually, when I was talking to him earlier today, we were talking about the importance of what we call daily briefing, roll calls, whatever it is. And I know me and Russ did a lot of topics on this because, when I was doing this show a couple of years ago, at the very beginning, they were starting to get rid of it, and they would just basically, it was about overtime and paying, but not realizing how important it is to get that daily briefing, because that's a great way for you to check on your staff, making sure they're good, and definitely give them the information to keep things safe and secure. But now, Russ, at this time right now, and not having these daily briefings, how does that affect what needs to be done at the facility, the knowledge that needs to get out there? And if the knowledge ain't getting out there, how does that ultimately affect the population, which seems to be everybody's main concern?
Well, I don't think that there could be a better example of a time where we need that sort of, shift exchange briefing. And, it's not enough to just, call your people on the phone and tell them what's going on. There really has to be an interaction, because, you've got some great staff members out there that have some great things to contribute. They have some great observations that they've seen with the inmate population that's going on. They've, seen things on the news. They're up to speed on what's going on. And essentially, if you're not running those type of briefings, what's happening is you're cutting all of those people out. And even if you're going around and you're trying to get to each of them, just that, top down type of briefing doesn't really cut it. I think everyone here is, pretty much, chimed in that, yeah, we have to be communicating with the inmates, with the staff. The inmates, especially, we got to realize that they're getting a lot of, probably, really pumped up information from the media, information that's kind of, false or fake, or, that's been spun to one degree or another. I saw an example today on where I was living in Pennsylvania before I came back to California, about a nursing home that the headline was kind of like saying, like, all 800 residents and the staff have COVID at this nursing home. And that wasn't even close to being true. The real truth about it is that they were saying that they're treating it as if. And so when you start sending this stuff out to inmates who might have loved ones that live near there or that work there and stuff, this really heightens their anxiety. And when it heightens their anxiety, they can be preyed upon by other inmates to get involved in things that they normally wouldn't. So, just again, I don't think we can put enough emphasis on that. We have to have, the good communication, the staff shift briefing, whatever you want to call it, is essential to that. We need to find a way to make everyone able to participate, because everyone should be bringing something to the table in this, because that's the only way we're going to, get past the end of it, is for people to really contribute and step up.
That's dead on, Russ. Just, hit the bullseye. And Russ, if I just want to say something, obviously in agreement, neutralizing that sensationalism, like putting an end to that right away. Because a lot of the things that we see right now, the inmates are acting on that. They're acting on what's sensationalized. And another good point that me and you discussed in the past, Russ, about the importance of roll call, which is another reason why we want to have it, is how about when all staff come in, a supervisor comes up and says, thank you guys. Thank you guys for coming in. Thank you guys for being here. Thanks for dealing with that code when the inmates were fighting in a COVID unit. Thanks for putting your hands on that inmate and still getting the job done. Thank you for the sacrifice, because now I'm sure you're home self-quarantined.
There really has to be a way for staff to be able to judge how they're doing. And if they're not getting feedback as to the job that they're doing, they're going to continue doing what they're doing. They're not going to innovate. You know, maybe if they're doing something that's a little bit subpar, they're not going to work to check that and bring that into line either. And if they're not getting some, you know, attaboys, they're not going to try and really take their game up to the next level either. You know, I've said it over and over again that this is one of the most thankless, dangerous jobs out there. No one sees what we do. Our supervisors do. Our supervisors should be working with us on that and pointing those things out, letting us know what needs to be done, and thanking us for taking charge. Because hopefully you've got the staff out there that are those go-getters. That's what I always wanted. I always wanted staff members that were go-getters, that I didn't have to spend a bunch of input on them, didn't have to spend a bunch of instruction, just kind of, you know, I was sure that they were going to go out there on their own and they were going to, you know, bring back a worthy result.
You know, Russ, it's obviously, again, spot on. You know, it's motivating. It motivates your employees. And right now, your employees need that motivation. Now, when I was driving home from work today, Brian was very passionate now about the need for roll call. And it wasn't about the overtime. It was about, hey, there's information here and the staff's not getting it. So I'm sure you would want to compliment what Russ said, correct?
It's absolutely absurd that we do not have pre-shift briefing or roll call. It's insane. When you think about the jobs we do and where we're going into, I mean, if you've been in this business the same amount of time as everyone on this panel has, right? What we do know for sure is that unless there's body bags involved or unless there's an escape involved, anything else, nothing else matters except for budget. That's what our commissioners have judged on. That's what our supervisors are judged on. That's what our wardens are judged on. It doesn't, none of that else matters. Unless there's a body bag or an escape, it's all about budgets. And so they cut us. I got to give Andy's organization, the MCO, a tremendous amount of credit for negotiating and getting roll call back for Michigan correctional officers. But it is disgusting that they have to negotiate for that safety. That is critical to our very existence to find out what's going on before we go in or behind those walls. To get the climate of the institution. Has there been new hooch found? Has there been new contraband? Are we dealing with nurses someplace? Has there been a pop-up of AIDS? Any other communicable disease? Are we have gang issues coming up right now? All these things are critical. And we're not told any of that anymore in so many of our facilities. And it tells you what management thinks of us. And it tells you what our legislators think of us. But we're to blame for part of it. We're to blame for part of it. Because for the 38 years I've been in this profession, for almost every one of them, we've been silent. Well, we've been a little blurb here and a little blurb there, but we have not come together as a nation of correctional officers like we have to. If we're going to get the change, we have to have. It's too late for me. I'm not going back behind the walls. But all these kids that are going in there, that are there protecting my family and my community, we owe it to them. Every one of us who is a leader in this profession, we owe it to them to get off our rear ends and fight for those men and women and make sure they get what they need. And roll call is a critical component of what they have to do their jobs. And the fact that they've gotten rid of it in so many states is deplorable. And when people have to negotiate for that, it's disgusting. It's like telling someone that comes in, give me 50 cents or I'm not going to give you a face mask to go in behind the walls today. It's absurd, it's disgusting, and it needs to change. Sorry.
No, listen, it's, you know what it is? It's passion for you because obviously, yeah, I mean, Brian, it's passion for you because you care. You know how important that is. Now, what I want to do is ask Connie, do you guys have something like on the medical side that's similar to a roll call or like some type of briefing? And if so, how important is it?
Absolutely. It guides everything that happens from the beginning of your shift. You know what the expectations are for the day. You know what's going down in the facility. So if there's been any communications that have come to, say, me as the HSA, so I'm going to get this information from the warden. I'm going to need to make sure that all of my team knows what's going on in the facility. If, like, you know, if there is some sort of gang activity going on, if we've had a new outbreak of head lice or scabies or anything like that, like those are things you want to walk in and know what's going on. And I mean, in this time right now, if there's been any developments, if we've decided that we're going to take a new approach to treatment, or we're going to provide some additional information, whether it be to the offenders or to the rest of the team, like That's what we use that meeting for. And we do it every shift. The nursing supervisor, myself, like shift to shift, you always know what's going on before you hit the floor. And if today happens to be the day that you're going to go cell to cell to do medication, you need to know that, because you need to plan your day accordingly so that you have enough time to get everyone at their meds. I mean, it's just all these things that happen that, like, if there is no communication, we can't support the activity.
I want to ask you another question, Connie, just to let people see how daily briefings that are not being done for the officers also affect our civilian staff, our medical, our program providers, whatever it is. So if our officers are not being given the right information at the beginning of the shift, couldn't that affect you as a civilian?
It affects everything. So for example, I have an example, right? So there was a point where we would come in, we have our call down list, and we give them to the officer, and we'd say, so here are the new people we need to add or take off for whatever reason. And so earlier on the day, there was a decision that there was going to be a shakedown. And so with that being said, this officer didn't realize that this was going to happen. It wasn't communicated to him. And of course, then it wasn't communicated to us. So now you've got tons of people sitting around waiting to see their people. They never show up. The officer's calling the unit. And it wasn't until he called the unit that the unit officer told him that, no, we're not doing normal operation today. This is what's happening. You know, and he's sitting there almost like, well, how come I don't know? You know, he's on post trying to do his job.
Yeah, 100%. That communication obviously is key. Because right now, obviously, you have valuable time, and right now the valuable time is being wasted waiting for inmates that are not going to get there. I have two more topics I want to touch on before we close related to what we're discussing. Part of it is where we're at now with some practices that are being done. And then the end result is I also want to talk about people now, and we could touch on this a little bit, people now being told to go back to work after some level of, I don't know how they're even doing the clearance after having COVID or the coronavirus. So first thing I want to do is go to Connie real quick. So New Jersey County Jail is doing a screening for all inmates for COVID-19, and they're using a new testing method. Now, mind the way, guys, testing methods are changing. At one, you had the nasal swab. Now you got some throat swab. Now you have it through spit, through blood. This test here is actually a 15-minute test. They're doing it in Essex County. Let me read it to a little bit, and then I want to see what's your thoughts on this test, Connie. And then I want to go to the other guys on the panel and see if this is something that we may want to push towards staff as well. So hear me out. So in Newark, New Jersey, so this is in Essex County, all inmates and detainees at the Essex County Correctional Facility will be tested for COVID-19, whether they have symptoms or not, using a recently approved antibody blood test that can deliver results in 15 minutes according to the county. Now, here's my thing. My opinion, if you want to devote money towards the test, it should go from the outside in, not from the inside out. You know, to me, this is more helping the inmates get released or whatever it is, opposed to the staff having to come in and protect the virus from the beginning. Because again, they're the ones that you want to test because they're the ones that could bring the threat in. But again, this is where the resources are going. The correctional facility is set to receive nearly 2,800 testing kits over the next 2 weeks and will then house individuals based on whether they've been exposed to the novel respiratory virus or not. County officials said in a statement, the jail is the first correctional facility in New Jersey to announce that widespread antibody testing would be available to its incarcerated population. The antibody test will have the ability to determine if individuals are positive and in the early stages of exposure to COVID-19, that they're positive with the virus but beginning to develop immunity, have developed immunity to the virus after exposure, or if the person's negative, allowing the jail to separate inmates based on their test results. So, Connie, what's the difference between this test and the test from the past, and can this really help?
So, excuse me. So I think first that it can really help. So, I mean, when you first read it, the first thing I thought about was there's this rapid testing that we do for HIV, right? It's 15 minutes. It looks for the antibodies as well. So what I'm thinking is this is probably just another way for us to get a quick response and understand whether or not someone actually has any trace of the virus in their body. Now, I think our reality, though, is a blood test is always going to be, you know, the kind of more of the end all be all, because the blood test will let you know whether or not, you know, there's infection in the body itself. Has this person's body been infected by the virus, right? And that's whether or not there's signs and symptoms. If there are no signs and symptoms, at least you have a test that will give you something more definitive. So, I mean, I think it's great that they would be doing this testing in the facility. But I mean, I do also understand your thought process about not testing. Like, how do you test the inmates and not prioritize testing the staff?
Well, let me ask you a question, then I'll get to the staff. Do you feel that if we had limited resources, let's say this was a limited supply and we had the testing, and you could only choose between one party or the next, would you choose staff? Would you choose the population? Where would your choices be? It's a tough one.
So I think that's a tough one, only because you want to be able to triage who's most critical, right? So if you decided that we already know that if you're over 65 and you've got some sort of compromised immune system, you have a higher susceptibility to disease transmission. And so maybe the priority is, who do we know could have been exposed? And that's the first. And then you go to those people who are over that certain age limit that the CDC is talking about, because you want to make sure that you are hitting the right people. And that's whether that's an inmate or a staff person, because I feel like that's how you begin to dwindle down who's the most critical in this situation. So if I had to choose, I would need to prioritize by who's top on that list of being positive, not necessarily using the benchmark of who do we want to release as the priority. I don't believe that's the way we should go.
Right. See, so for me, I think we're in line with a lot. My only concern is I figure if we want to prevent the threat from coming in, and I'll forward this question to Greg, and then we'll go down to Russ, Brian, and Andy. I would probably, again, this is just my opinion. I'm not, who am I? But I would probably choose staff. Only because, again, I feel that could eliminate a lot of the threat that's coming in. Oh, hey, you got a dog, Bri? Hey, but I would choose staff, and again, only because I want to start eliminating the threat coming in. So I figure if we could catch those who are walking around that don't have symptoms, that could at least lessen it. But mandating staff to take tests, I mean, it's not as invasive now, so I don't think it would be that big of a deal. And I think a lot of staff would want to get tested because, they would want to know, am I bringing something home to my family? But Greg, let's go with you first, Greg. What's your thoughts? Testing staff, testing inmates? Do you think it's okay for us to mandate staff to be tested? I mean, what's your thoughts?
Well, I think everyone's going to want to get tested, but I'm going to have to agree with Connie, because at this point, the theory of outside in probably doesn't hold any longer, because it's been around so long. We could have asymptomatic carriers already in. We could have offenders who are already carrying it and are asymptomatic. We can't guarantee that nobody inside the walls had it. If this was a month ago and we had this blood test, by all means, test all the visitors and staff, because we know 95% of the offenders don't have it because they haven't been exposed. But now it's been so long, we're going to have to test everybody. So I'm going to defer to Connie and her expertise in this area. All hail Queen Connie. That we we start with a triage system, and that's staff and offenders, age brackets, autoimmune people, and work our way through it. Staff shouldn't have a choice. They're going to have to get tested. And maybe that's a union thing. It gets a little tricky, but for one, I was the kind of guy who never refused a strip search. I never refused a pat down, and I'm certainly not going to refuse to take some sort of test that's going to save me and my buddies, my back the blue. So I think we definitely should be testing everybody, and I'm going to agree with Connie. It's got to be a triage system if we have the tests available.
Right. See, I guess what my concern was, and again, I guess a little myopic, was I was looking at the either or on like an extreme, a spectrum. Like, if you could only test the inmates or the population, the inmates or the staff, I was choosing staff. But you're right, 100%. I'm not going to argue with that. If you get to choose a way to balance both, is there a way to balance the approach of, can we test inmates and staff so we can try our best to eliminate the threat? But my concern is that when you have limited resources, I find that, in this case here, like Essex County right now, Essex County is really focusing on the inmate population. I don't think that's the end all. I think that you have to balance that. I think that, like, maybe, I don't know if we're on the same page here, but maybe, yes, a certain of the testing obviously has to be the population, but in the process, I think we have to definitely check out staff as well, because they could be the carriers, even if the inmates are the carriers, they received it at one point. So we still have to go back to the origin. We still have to go back to, okay, so we got the inmates that have it, but it's not going to prevent it from coming in again. It's just going to maybe help it from getting out. So we have to eventually devote some way to kind of balance, okay, we'll give this to the population, but we still have to make sure we cover staff. What's your thoughts on that, Russ? Are we on the either or, the balance?
No, well, if I were the one in charge and I was running this, as I started to test the inmate population, I'd do my best to be starting with staff at the very same time, for a very pragmatic reason. As we can start taking and segregating these inmates that test positive for the antibodies out, I'm going to want to start putting my staff that also test positive on that unit where those same people that tested positive are. That way, my staff that are left over that don't test positive for it, that don't have any antibodies, can watch the inmates that also don't have antibodies. And that way, we can get some separation maybe amongst those units, so that people that are either already protected or are on the verge of breaking down and having some symptoms, they're kept more in one area, and that way we can protect the other population and some of these. Now, this is kind of dependent on, how much separation can you get, where are your different, avenues of ingress and egress, and how much can you really separate these people. But that's what I would be trying for if I were put in charge.
Yeah, you're actually touching on to the latter topic of bringing people back. Now, I don't want to discuss this yet, but I just want to, part of it's to compliment what you just said, because a lot of people are going to have a concern with something that you just said, but I actually see what you mean. So let me say what the concern is going to be. The concern is going to be is, did you just say that a staff member that tested positive for COVID should be working? The thing they have now is, if the person's not symptomatic, okay, is the person a risk? Yes, but if they're around other people that have COVID, that's going to be what people are looking to do, believe it or not. That's how bad it is for us, because we are essential and we're losing numbers like crazy. One positive staff member can eliminate 50 to 60 people. So out of desperation, which I can kind of understand, and it's tough to say because we're going to touch about this in a little later, but if the person is not symptomatic and still able to work, that means that this person has an immune system probably that can fight it. Still put them in the protective gear. We're not telling you to let this person, walk around unprotected, but that's probably going to be where we're at in a couple of weeks from now, Russ. You probably just predicted, and we'll talk about it in a little bit, the 3 weeks ahead dialogue that's going to wind up happening, because we're starting to touch on people that could still be positive that have to come back to work, but they're not symptomatic. So now I want to go to Brian real quick. So Brian, I want to talk about, again, the same thing with the testing, but for you and Andy, from a union perspective, don't touch on the latter part yet, because we're going to have that. I want to touch on that in a second, but I want to talk about mandating the officers to take the test, and or mandating staff to take the test, and who do you think, if you have limited supplies or balance, whatever it is, who are we giving the test to? How do we balance it out?
Well, that's not a real easy question to answer, obviously, but I think there's several different ways to look at it. I like Connie's approach, but I also think too that if you have a facility where you do not have any of the inmates so far showing symptoms, then I'd be wanting to test the staff to make sure that it doesn't get in there. If it's already secured and you don't seem to have any problems in there now, I'd go to test the staff first. However, if it's the other situation, whereas you do know you have something with inside the institution and you have now this is only if you have limited resources, then I would have to say you'd have to test the inmates first to find out what was in there and where it is, so you can confine it. But that's with limited resources. Ideally, and it should be, we shouldn't have to be talking about this. It should be straight out test everybody. Plain, simple, candidate, test them. That's it. But it's fine. This is a killer. This isn't anything to play with. This is not something that you're like secondhand smoke or any of this other baloney. This is going to kill you if it gets into you and you have a weak system. There's no games to be played here. People need to be tested.
And I'm going to tell you something, man. You've already hit spot on with the symptoms approach. Connie and Greg, would you guys agree to that? That was pretty good, a good balance to what you guys had mentioned.
Absolutely. I think Brian's clearly the passion is coming through that if the resources are not available, yes, we have to go towards staff. Now we're going to run into lawsuits. We're going to run into, oh, you're trampling on my rights, but we have to protect those that are going in and out and are going back and forth. But I don't know how many facilities are left that don't have exposure. I would love those numbers, but I don't think we're going to be able to get numbers from 3,500 jails to know which jails aren't showing people with symptoms at this point. I'm sure it's just about everywhere. But yeah, we have to, obviously, if we've got symptoms, then we have to work from both staff and inmates at the same time. If we're not showing symptoms, then yes, I would absolutely lean towards staff first, taking priority with testing kits.
Connie, that's what you were getting at, correct?
Yeah, I mean, the reality is that the liability is real no matter what, right? And so I think if we don't, because in the circumstance of us having limited resources, you will have to triage. That way the right people are getting tested and you're not wasting the resources. In the situation where you know that you don't have, it hasn't gotten into the facility yet, or you've not seen any outbreak of signs and symptoms, I would then lean towards testing the staff to make sure that threat is not coming into the facility. So I just think that depending on the circumstances that are presented, you've got to make the best decision that you can make with the information you have.
And I want you to know, guys, this dialogue is, I don't know if it's happening right now. I mean, it could be, but definitely not on a forum like this. So we're jumping ahead of the game. You know, we really are. We're jumping ahead of the game, giving people knowledge if they're watching. And again, with Andy, you know, being a union representative yourself, do you see any problems with administration or management saying, okay, guys, if we decide to test staff and we want to mandate that, would you think we get a kickback from the union?
No, I'll just say this. The complication in all of this is the symptomatic A, right? That's the complication, because you don't know if it's in a facility. Just because nobody's showing symptoms doesn't mean it's not in there, and doesn't mean the staff aren't going to contract it, and doesn't mean it's not going to sweep through there sooner or later. You know, 2.5 weeks ago, we had facilities that didn't have none. In 2.5 weeks, they got 200 people that have it. That's how fast it moves. And nobody really knows how it comes in or if it was there to begin with. So, I mean, that's the complication in all this. I think Connie's right, though. If you got limited resources, you have to try to figure this out in a way that makes sense. I'm going to put a little spin on this, though, if you don't mind, Tony, because our officers, what's happening is they have to use their own sick leave. If they come in and they have a reading with one of these goofy gadgets over their forehead that says they have a temperature, they have to go home for 7 days. No matter what, they got to go home for 7 days. Whether they're showing symptoms or not, they got to go home. They might feel great the next day and not have a temperature an hour later. Doesn't matter, 7 days. If they don't have enough sick time to cover it, they're in lost time. They're without a pay for those days that they don't have sick time for, right? That's going on across the country too. Our survey showed that most places aren't providing sick leave for a lot of officers. And then on top of that, if you have any other further symptoms, you got to come in, you get a reading done, and you got a 2-page form. If you picked up a cough, if you've been around anybody that's suspected even, you're off for 2 weeks. And that 2 weeks, you know, you could lose a whole paycheck in 2 weeks if you don't have enough sick time to cover that, right? So that's a problem. So we're saying test our officers, test them, get them back to work. A whole bunch of them want to go back to work. By the way, even some that have had it and they don't have serious symptoms, say, put me in with those that got it. I'll work in there. I can do it, right? That's how dedicated they are. That's how come they want to come back, and most of that is because they know their brothers and sisters are so short-handed and they don't want to leave them. I can tell you, I'm sick to death that I don't still work in there, believe it or not. I've never felt guilty since I retired. I've seen a lot of shit like a whole bunch of you have. I've been into it. But I'm going to tell you, this is the first time where I really feel sick and guilty that I'm not in there with them and I'm not in there working with them. I really do. It's amazing, but that's how I feel. And Tony, and I hope you feel better too. I know you're dealing with some stuff you don't even know, right? It's the not knowing. And that's the other part we haven't touched on. You should do a show about is the wellness though, because that wellness needs to be front and center. These folks aren't going to be reaching out. They need to be reached too. So I just think that's something else, but that's another spin on and whether we should force people to take it or not.
Damn, I'm always lecturing everybody else. I mean, you hit something real with me because the unknown, you know, you're talking to somebody and the next day you find out, hey, the person you just spoke to had COVID, or you're in an area that, you know, you find out, oh shit, I don't have my PPE because you're so used to walking in the area and just found out that an inmate just left that area that was COVID. You know, I'm saying these as generalizations because I have to say them as generalizations. You know, but you guys have to read between the lines on that, whether it's true or not. You know, I'm still on the job, but the point is there is an unknown, and a lot of our concerns are, even though if we make it through all this, what happens to us after? Like, I mean, we're creatures of habit, you know, so right now you're starting to see people condition themselves to the distance, which is opposite of who we are. Like, you know, it really is. It's opposite of who we are. And once this becomes habit, you know, what kind of society do we go back to when this is all done? You know, I remember, you know, working and there's everybody close and being together. And now it's, you know, maybe a couple of weeks ago, you would forget, you know, that you had this social distance going on because, again, you're not conditioned to it yet. But, man, now if you're not within, you know, if you're within too close to that 6 feet, it's like it's automatic now. These reactions of pushing people away are becoming automatic. To the point where I don't know what happens when it's done. You know, when this is done, we're going to have a conversation of how do we rebuild from this, what was normal for the last couple of months, or who knows, maybe years. You don't know. I mean, people are giving us different figures all the time. But my concern is how do you bring back what we're about, which is that social networking, that closeness. You know, it's hard for me, and all jokes aside, because it's going to come out funny, but I love to talk, and I found out recently from this now, from COVID, I'm a pretty close talker to people. I didn't realize that. Yeah, there's Greg. You know, this is shit you don't realize until now. Like, I don't realize, like, you know, how, and I talk to everybody. So, you know, God forbid I come across with something, you know, but it's just who I am, you know. So I'm trying to go through this without remembering my roots and not changing who I was, you know, and that's the conflict. And I think that's the conflict, a lot of us that are social creatures. Of course, you know, to me, it's also like a giant game of cooties. You know, I don't mean to joke about it, but it's true. You know, everybody right now is treated like cooties. Now, the last question I wanted to touch, which is I think very important, it kind of touches on what Russ was saying. And I think that I want to get across this now because this is definitely going to be dialogue that's going to be coming up in the near future. So we can actually say we discussed it first. Now, how we discuss it now may change in 2 to 3 weeks, but we can still pioneer the dialogue. So I thought what I'll do is I'll start off by, you know, posing the question. I'm going to go to Connie first, and then we'll work our way down the panel because there's a medical side to this. So I want to talk about, okay, someone has COVID, they're done. How do we know they're good to come back? That's one thing, because I've heard two things, and I'll have you, I don't know if you're aware of the, I'm sure you are, the 72 hours, no symptoms, or the tested negative for 24 hours twice, whatever it is. But how do you feel now? Because in the department, we're also desperate for numbers. How do you feel about bringing people back that may test positive but don't have symptoms? So let's first talk about people that were out with COVID, that were sick. How do we know they're clear to come back?
So I think we honestly don't know. So there's been different studies out there. One study I saw said people, even though they were asymptomatic after the 72 hours, there was some where the actual symptoms came back, like beyond the 72 hours. And then there was another study that I saw that they were asymptomatic for like a week or so, and then they weren't well again. So like, I don't know that we know for certain that someone is clear to come back to work. I think, and there's not enough data available, I think, right now that says you can't get it again, right? So even if you came back, you were you're now you've been out 72 hours without any signs or symptoms, and then you go back. In my mind, I'm thinking this person, their immune system is now compromised. And so they go back, and then do they become just susceptible to getting it again? Like we just simply don't know. So I don't know. That's certainly on the healthcare provider to make that final determination. And I just feel like there's definitely a risk because there's still so much unknown about the disease. What we do know is that it's very efficient in transmitting from one person to another. And, you know, today I heard it referred to as its transmissibility is extraordinary. And so when you hear that, you say, well, how do we send people back to work if we can say that, you know? And then, of course, there's no cure and all the other reasons why. But, you know, I would say if there's some medical doctor out there who, you know, the medical community has decided that this is the action that's appropriate, like who are we to say not, right? Unless we see otherwise. And I think we've seen otherwise.
My computer is doing something funky. But let me ask you a question. What about that test that is 2 negatives within 24 hours? I've heard that's another approach that people are using. Would that be a good confirmation?
I mean, I think it's as good of a confirmation that you're going to get, you know, like there's really no, I can't say that it's just the blanket okay to go back. Right. I mean, unless we've had enough people that we've been able to test post-COVID and saw that it didn't come back and that they were okay, right? But then you also have to look at, so what are all the other contributing factors, right? You look at what are their pre-existing health conditions? Were they healthy prior to? And all of those things would contribute to this person either testing twice and coming back negative or testing twice and then still coming back positive. I think there's just a lot still unknown before we can say like, yeah, you're just clear to go back.
Now, one last question for you, Connie, on this one is, could a state doctor overrule the person's personal doctor? So if you have, we touched on this before. This is not an easy question to answer, I know, and I'm probably going to ask it again for you guys here, but you may have some personal doctors that say, hey, this person is not ready to go back. And then the state decides they have their own doctor that says they are. Who can supersede who? Is there a liability there or?
So, I mean, the state's doctor is supposed to be an independent review body. And so the thought process, my experience has been when folks go to their regular doctor, sometimes you can say, hey, doc, just keep me out for another week. I'll go back after, right? And whether or not that happens or doesn't happen, not all apples are bad apples. So I don't want to put it out there in that manner. But what I would say is that the state doctor is supposed to be an objective body who's just going to take test results and give you, here's the determination based on what their exam has yielded. And in that instance, I would see if the state says they can go back, certainly there's liability that you now have my personal doctor who said I can't go back. The state's telling me that I can. And once I go back, if anything happens, the door of liability opens.
Right. Now, I know Andy may have to go real quick. So we're actually getting ready to wrap up, and I'm sure Brian may have to too. So I'll go to you guys first, and then if you guys have to sign off. So basically, I was wondering real quick if you could answer the question I asked, and then I guess because you guys have to leave, maybe I'll get your closing thoughts as well, and then I'll go to Russ and Greg to finish off the questions, and then we'll do our closing thoughts with Connie in a bit. But Andy, same question I want to ask with the bringing people back. What's your thoughts on that? Also, what's your thoughts on what Russ mentioned before with I really do think that's where it's coming, where if they're testing positive but they're not symptomatic, if they're willing to work in a unit that has COVID positive inmates that could help. And what's your thoughts on, I know it's a lot, man, but I know you have to go. I don't mean to overburden you, but what's your thoughts on the state doctor versus the personal doctor? And then if you have your closing thoughts before you leave.
So I'll approach the one I think is probably right now, currently, an easy one for me to answer. But I would say that I bet you, Tony, if we're all back on 2 weeks from now, the conversation will probably be different then, right? So given that, because this thing is moving so fast that the opinions that I had even a week ago I have shifted. And I think all good leaders, given the theater of life, will shift their approach and their opinion and their thoughts, right? So that being said, I think I would not want them back in. If they're sick, they're sick. And let's make sure that they're healthy when they come back into an environment that can do a lot of things to you. And I know a lot of our guys, they want to come in no matter what. They really do. But if they're sick, they're sick. That's the opinion I have on that one. Whether they want to work with those that have it already or not, I don't think they should. Now, we got to run the joints, right? We got to run these places, and I get that, and I understand that, but not at the cost of one of our brothers or sisters. That's all I'm saying. So the other part is this. You had two questions for me. That one was one question. What was the other question? Oh, go ahead. What was that?
Okay, so the one question which I believe you answered was compliment what Russ said before, because I said in the future they're probably going to have people that are COVID positive. But what's your thoughts also on how they're getting cleared to come back, or
So we have two things. We have our inmates get tested one way, and it's very quick turnaround. It's 24 hours or less. The officers, they weren't getting their tests back for a couple of weeks. Now, some of them went to their family doctors and got the test taken so they could come back because they got cleared, because they were cleared, and they didn't want to have lost time. And they want, the whole thing. And the state wasn't letting them do that at first. Now they send our guys to, if they have the suspicion of having it, they send them to the health department. And the health department gives them the test like they do the police officers in Detroit, the firemen in Detroit, and others, the first responders. So we take the same test, and then within 15 minutes, they get the answer, they get to come back, they get to check in, and they're free to come back to work. So that's how it's happening right now with that. That could change as well, but that's what it's happening right now.
Well, before we go to Brian, hey, Andy, I know you got to go. Do you have any closing thoughts that you would like to give out to our audience?
I would just say this. We talk a lot about what was normal and wanting to get back to what was normal. Anthony, I get, when we go through shift change and everything else, a lot of us hug each other. And it's a brother and a sisterhood. And so there is that close contact that I couldn't imagine losing that. For all of us, we need that kind of interaction. It keeps our hearts as soft as they can possibly be in this line of business. But I would say this, we should not accept what was normal. We should not accept the fact that we got a bargain pre-shift. We should not accept the fact that we come second all the time in this. We've got issues out there that were not good enough when it was normal. Now looking at it now, this has just brought it to the surface of how important it really is. We shouldn't let it go, Anthony. You're the voice, dude. Don't let this go. Everybody on this panel knows what I'm talking about. We got to raise it up. We got to keep it up. We got to come together as an industry. Thanks, everybody. You're amazing. It was great being on once again, Tony. Thanks. I appreciate it.
Thank you, Andy. And Connie's going to reach out to you because I think you guys would really work well together. I value both of you tremendously, and I think you guys have tremendous voices. So I appreciate the both of you, but I appreciate you, Andy.
Yeah, take care of yourself. Good luck to you, Tony.
Thank you, brother. Hey, Brian, I know you got to go too. So just real quick in closing, one thing I wanted to touch on again, maybe you could help me out with this, is the conflict that you may have between state doctors and personal doctors. I know that's probably going to come up. And you know what's funny, real quick? I'm sorry, but I've got to mention it again. I believe this is something that I would like to think we would police each other on, where if you have officers that are abusing it, they know for a fact that they're hurting officers who are probably zombies at this point, who are working many hours. So I'm sure there'll be, if there are people that tend to misuse it, they should be policed by their own who's saying, hey, yo, because of you, I've been working 16 hours a day for 5 days a week, so you would have some level of policing between each other. But what would be your thoughts on, I guess, same as I asked Andy and Connie, is what would you feel comfortable in having them coming back? But also, I still want to compliment what Russ said. If the person's not symptomatic and they may test positive, but they're not symptomatic, I could see it getting to that point where they're going to have them supervise units still protected, but in those areas that are COVID positive. So you have a couple of little questions.
I won't work with them. You won't get me to work with them. If they're testing positive, I'm not going to put my family in danger. No way. If they're testing positive, if you don't have enough staff, hire enough damn staff. Don't be doing this stuff and putting people's lives in danger because you want to shove somebody in there and they're positive. We don't know enough about this at all, Anthony, yet. We're way, way behind the learning curve on what can happen with the disease, how it comes back, when it comes back, if you actually build immunity to it, and if you do, how long does that immunity last? Does it last a month, 6 months, a year? We have no way of knowing any of those things. Until we have a vaccine that can stop this thing, no one should be behind those walls if they're testing positive. I'm not a doctor, but I wouldn't work there. I'd be the first one to say, no, you're not going to put my family in danger unnecessarily. I'll go and do my job, but you're adding somebody to the mix that could absolutely devastate me and my family and my coworkers and everybody we're taking care of in there. So no, I wouldn't go along with that. And
okay, what about the personal doctors versus?
That's a simple one too. To me, that's a very simple one. I listen to my personal doctor. That's the one who knows my history. That's the one who knows who I am from top to bottom. I don't care what the state doctor says. I go with my doctor. They're a licensed physician, and their opinion is their opinion, and that's what I would go with. I wouldn't listen to the state doctor's opinion. That wouldn't matter to me.
All right, now, Brian, do you have anything in closing that you would like to say to our audience? And again, thank you for what you do. You're part of a tremendous network of individuals who are really just getting the information and bringing about a consistency to this profession that hasn't been done before. So,
well, you're a big part of it too, Tony. It's all about education. It's about three things. Now, we have EAPs in our business, right? Employee assistance programs. Well, our EAP that we need as a profession is educate, advocate, participate. Learn this information. Find out what's going on. Advocate for your profession. Make sure you become a voice for them and participate in the upcoming changes we're going to need to have. Let's not lose this opportunity to make sure that when this comes around again, and it will, it may not be COVID, but it will be something else, and we'll see it again. Let's make sure we're ready this time. Let's make sure we have the PPEs. Let's we do our job as the frontline officers and force management's hand and force our legislators' hand to make sure we have these protections on ready when this comes again. We're so woefully equipped right now, it's horrifying. And we really need to address these things. And I guess the last thing I would say to you is unity. We all walk this beat together. And we need to act like we walk this beat together. And thanks a lot for everything you do, Tony, and for your tremendous panel and your guests. So nice to see you all and meet you. And I hope we get to work together in the future.
Yeah, we're gonna touch base in a couple of weeks because I'm very curious to see where this leave goes. And I think this is definitely another setup for a future dialogue because I know you're gonna be all over that. So we could touch base in a couple of weeks, see where we're at with that.
Sounds great. Look forward to it.
All right, Brian. Take care, brother.
Everybody, stay well.
All right. Hey, Greg, I still want to explore that question because I know this may sound crazy, but I kind of understand what Russ is saying because Russ is a forward thinker like myself, and I could see us getting to the point where our numbers are desperate. And is it the right thing? I'm not saying it's the right thing, but I could see it's going to be something where if you have someone that's positive for COVID, but they're not symptomatic and they're fine, would you be okay with them working in a unit, if they were okay with it, of course, with COVID inmates?
Well, wow, that is a precipice that you're asking me to step off there. If I'm asymptomatic, somebody's got to work in that unit. So the type of person I am, the type of officer I am, if it's between me and sending Russ in there, yeah, I'm going to go in there. Because if Russ hasn't been exposed to it, then somebody's got to go in there. And I've already been exposed. I'm going in. I'm going to do it. Somebody has to work in those units. Somebody has to be tending to those offenders. We don't want to. Nobody wants to have to do that job, but somebody's got to be in there. So Who's going to do it? Well, it makes the most logical sense, as twisted as it might be, is to send the officer who's asymptomatic, who's already been exposed. They've already got it, so who better to send in there? You're going to send somebody who doesn't have it? Well, then you're just exposing them to a greater risk. I don't want to send anybody in there, but somebody has to go in there. So in this particular case, yes, Russ has hit the nail on the head. Russ, great job. You found this. You found this the nut, you blind squirrel. This is the conundrum we're in right now. Somebody has to watch these offenders. Who's it going to be? Well, you're not going to draw straws. Is it going to be a lottery? I have a friend of mine. She is a nurse, and they actually are having a lottery to determine who's going to go be working in the COVID wings of the hospital at 6-hour shifts. So they took volunteers. They don't have enough, so they're actually going to have a lottery. I don't want our officers to do that. Why not pick the guys who are going to step up? And it makes the most sense to have the guys who are asymptomatic, already have it, to work those units.
Yeah, I'm going to tell you something. I'm going to assume that this is going to be a dialogue in the near future anyway. So maybe our thoughts will change, but at least we put it out there because I know that they're going to be asking that. Like, you got someone that tests positive, because we're going to do these tests, obviously. Eventually, I'm sure they're going to get to a point where they test staff, and you're going to have people that are testing positive that are like, dude, I don't even know I had it. Like, I feel fine, or maybe I just got over it and I'm testing. I don't know, but the point is, because our numbers are so short, could I see that being a benefit? And I'm not a know-it-all, whatever it is, but it's an option that I don't want to be a bad guy, guys. So please don't take it the wrong way, guys. No, I'm very pro front line, but it may be an option where we're forced to explore it if the person's willing to step up. And our people, they're going to step up. They're going to say, Gange, like you said, Greg, I had it, or I have it now, but I'm not symptomatic. I'll work the unit because most likely, since you haven't been exposed, I have a better chance of fighting this bad boy off. But Connie, I don't know. Did you get a chance to answer this?
No, actually I didn't, but I was just thinking from the devil's advocate perspective, right? So we still don't know enough about the disease to know that if the person was positive, if they're asymptomatic, if they are now in the unit surrounded by all positive people, does that get them sicker? Like, does that then take their the antibodies? Like, how does their body respond to being in an environment with everyone who is positive? And so suppose something got worse for that officer who's now in that unit with sick people, right? Like, I know that folks would make the sacrifice. They would volunteer and go do it. I've seen that happen just in general when we've had crazy situations happen in the facility. But, what is the cost to that officer, given that we don't know enough about the virus to know, are we putting that officer in harm's way? Is it better that the healthy person go in there and go in protected, and we not make the one who we know is already compromised sicker? I mean, I don't know the answer to that, but it's just a thought.
Well, it's the unknown. My mind works a little crazy. So the moment you're saying this, and obviously I agree with you, Connie, you're my expert on this, but I'm thinking of something similar to the chicken pox. You get someone who had it and they work the units that have inmates that have the chicken pox. And if someone didn't have it, they can't work the unit. But
we know with chicken pox, you can't get it again. And we don't know that with Corona.
Right.
That's a great point, Tony. I think what we need to do is, to Connie's point, absolutely, we don't know. In Wuhan, they're studying what's happening when these people are going back to work now. And in South Korea, when these people are going back to work, are they becoming re-exposed and are they becoming sick again? So we don't know. That is absolutely the question of the day. Like you said, we're going to be back at this in 2 weeks because I don't think we're going to have enough answers. I don't think we know right now what happens when someone gets reinfected. So I think the next panel, Tony, you're going to have to get your boy Tony Fauci on here with us. Maybe you can get him. You paisans, you guys work together. Maybe you can get him to come on, get on the show with us.
Well, hey, Rush, we're boys, so I'm defending your thought like crazy, but I do agree. You want to maybe, now you could defend that thought a little bit?
Well, I think that the thing to really keep in mind here is that this thing is in a really fast stage of evolution. The things that we're talking about in this is probably is something that we wouldn't have considered 4 or 5 weeks ago. We would say, you know what, that's a crazy thought. But the thing is trying to be able to project what's going to happen down the line and try and bring this dialogue about, because there's some things that we need to start thinking about. There might be some hard decisions that some other people, thankfully it's not me, are going to have to make. Earlier today in Keepers of Chaos, I was talking about this. There's a couple of things out there on the horizon that might keep a population of officers up and working. One of which is, convalescent plasma. They've proven that works to a degree. There's also some indicators that maybe this hydroxychloroquine can have a preventative and prophylactic effect too. Nobody knows. So right now it sounds kind of crazy and experimental. But if 3 or 4 weeks down the road from now, you can't even man an entire shift at a facility, what's going to seem crazy then? Maybe trying some of that, maybe trying to keep people on their feet with some of these things. Maybe then it won't be. I don't know. I'm just pointing things out for people that they can take and go make the hard decisions that I don't have to. But I like to be that guy that thinks outside the box and tries to bring some unique perspective to something. Maybe it's something that will never happen, but I like to throw it out there and let other people mull it over. And Connie's in a much better position to assess some of this stuff than I am, but I just like to bring it up.
I mean, one thing I wanted to say though too is that I don't think we're in a situation where we'll be able to set it and forget it, right? I think that this is one of those times that because the situation is so fluid, we may be able to, this is the solution based on the information we know right now. And in the next 2 weeks, 3 weeks, 4 weeks, we may need to change the direction because we've got new information. So I think that we just have to be prepared to be pretty agile right now in any approach that we take, because there is no one answer to this. So I don't disagree with what you're saying, Russ. All I'm thinking is that might work right now. And so as we get more information, and it's unfortunate in the beginning when you guys talked about, we don't want folks who have died to have died in vain, right? But if something happens to that officer who was positive, who's now in the unit with all positive people, and somehow that accelerates his transition, I think that's the information we start to base those decisions off of. This was not a good idea. We lost people doing this. Now we know we need to do something else. And so then that transitions or turns that decision to someone didn't die in vain. We've now been able to save X amount more lives because this is something we tried, it didn't work, and we made a shift immediately following that. So I just think it's just staying on top of it and just not thinking we've got all the answers, and knowing that we're going to have to change tact as we move forward and we learn more.
You know what? As we were discussing this, I put up a poll. I put up a poll right now on my YouTube channel, and this is what I asked, and I'm sure we're going to be very interested in results of this. Once you reach over 10,000 subs, or forget whatever it is, you're allowed to have a community page, and you can do polls and whatever it is, and kind of post as if it's Facebook comments. So I asked, to our brave men and women working in corrections, if you tested positive for COVID-19 and you were asymptomatic, would you volunteer to work a COVID unit? And right now I have 2 votes, and I just posted it up, and it's 50-50. So, but these votes usually go to about 200-300, sometimes more. I mean, I haven't done a poll in quite some time, but I understand about the result. I'm assuming in the near future, maybe within the next couple of weeks, they'll determine hey, once you have it, you're pretty good, or if you have it, it could be worse. So once they make that determination, obviously we'll have this discussion again, but I would assume that if you had it and you're okay, I know if I had it and I'm in administration, but I had it and I was okay, I'd work the unit. I still protect myself, but I would volunteer. I would step down and do it. You know what I mean? I would feel I had to, but I'm sure a lot of our brave men and women, but I like what Connie and you guys are mentioning is there is an unknown. There is an unknown. The unknown is, are you okay? So that's obviously a concern, but definitely something we could touch on. So maybe our next discussion could lean on that, and we could also discuss on what do we do when this is done? Like, how do we build the morale back up? Because I'm telling you guys, it's affecting us because we're becoming strangers to each other in a world that we have to be close. We work in corrections. You have to be close, because if not, I don't risk my life for someone else because of the money. I risk my life because it's Russ, because it's Greg, because it's Connie. You start losing out on that closeness. You start losing out on a big piece of that motivation that makes you respond to a code, that makes you risk your lives, and it's very unique right now. I can't explain it, but it's a unique vibe. I never dreaded going to work, and now it's times are different. But in closing, what would we like to say? So let's start first. Let's see. Connie's a C, Greg's a G, Russ is a R. So we'll start with.
You're an A.
Oh. Can I tell you something? I was actually going to start with Greg. I don't know what I was doing with the letters. Why do you automatically assume I was doing something in alphabetical order? All right, so we'll go Greg, Russ, and Connie, because I got Greg the first picture here, Russ second, you third. What do you got, Greg?
Well, are we closing? Is that what you're asking me to do?
Oh,
here?
yeah, sorry. We're doing closing comments, Greg. I guess that's your closing comment. Goodbye. No, again.
Yeah. Being stuck outside looking in for the last month or so, not being able to get to facilities, I've been struggling, and I am definitely trying to find all the content I can to get out there. I've been praying for correctional brothers and sisters, talking to folks on the phone, working with you guys here on these web talks. And I really am at a loss. I have seen a lot of things. I've gone through, we had a series of, fires several years ago at some facilities. I've had situations where we've had food riots. We've had situations where we've had staff shortages for all sorts of stuff. This is such a unique experience. And I know that 25 years from now, my grandkids are going to say, Granddad, what did you do during the COVID? And I'm going to be able to tell them I talked to Anthony Gangi. What a great opportunity that's going to be for me. But the men and women behind the bars, behind the walls, we are absolutely in your corner. We're going to continue to dig deep. We're going to continue to dig into every facet we can, every resource we can. I know at our company, we're actually trying to come up with some resources as we speak. I hope to be working and doing some stuff next week because we are bonding together. Brian said it beautifully. We are shoulder to shoulder, locked elbows across the country right now with our brothers and sisters behind the walls, because you're not alone. And we definitely want to make sure that we get everybody home safe.
Right, well said. And we're supposed to have that show soon. We'll talk to Ken on Monday, and then we'll all get involved. It's big things, but I don't want to say anything because we got to make sure everything's positive. But definitely got a guy, Guardian RFID, that it's not about the money for him, man. It's passion for this profession. I really think that he would put everything he got to protect just one of us. And trust me, we're doing a movie together, and we're telling the story of a falling hero, and it's not free. I'll tell you that. I know how much it's running, and that's on his dime because he cares that much of the profession. There's no marketing there. There's no marketing. It's just a fallen warrior whose story needs to be told, not just for her family and herself, but also for the profession. So, and then making the connections I've been making recently, what I've been doing on the side, it's like there's a plan and it's starting to happen. It's like you had to wait, but it's starting to happen. I mean, think about the timing and, it's crazy how you wait for something and all of a sudden, you want it on your time, but it's not about that. You remain patient. All of a sudden the universe starts to unfold. I used to tell people, I used to tell them that sky's no limit. Like reach for the sky. Sky has no limit. And someone goes, unless you're an astronaut. At that point, the sky is the beginning of the journey. So for me, I feel like I was doing this whole thing where sky was the limit. I could go wherever I wanted to go, but now I'm starting to realize that I'm lucky. I feel like I'm actually in a spaceship and the sky was just the beginning. So I feel blessed, and obviously having you guys on. I mean, me and Greg did a great breakdown the other day. It's going very well. I'm learning how to maneuver a little bit with the channel to get some, you want to get more viewers, but you want to try to increase, you want to be diverse with your topics. And right now, the coronavirus, but what we're doing now has a chance to bring this profession together. but also bring people from the outside in, because people are looking up coronavirus, so we may just happen to show up in their search and they may say, oh, wow, it is affecting the jails. But that wasn't their intent to look at that. Their intent was look at the coronavirus, and all of a sudden here we are talking about the jails, and it brings in that one or two person, it doesn't matter, one or two. But it was funny, before I go to Russ as a closing thought, I just got messaged on the community board, and someone said, keep up the great work. You deserve more views. That means a lot, and that's someone that works in the profession who appreciates what we do. Hey, Russ, what's your closing thoughts on all this?
Well, I think that we're at that point in this thing, and Connie was exactly right. This is so fluid, and because it's so fluid, it's extra scary. That just means that we have to be really good with our decisions. We have to be really good with the actions that we're going to take. But one of the things that I think we've seen that's been kind of against us, kind of, putting us in that current where we're fighting it, is too much inaction. But I think that we have enough talented people out there, and people that are really willing to, take the fight to the COVID and to fight for the things that our people need, that we're going to come through this just fine. I really believe that. And I just, proud to be part of this little round table and stuff where we're putting some things out there. Hopefully some of this in some way is going to inspire or motivate or bring people to really come and bring their best to this situation, because that's the only way that we're going to, move the chains down the field and finally put this thing to bed at some point, however far in the future that might be.
Yeah, but I'll tell you something. We'll keep the stories going, and we'll take it the distance as long as we got to go, because that's what we do. We'll probably have another show, probably if not tomorrow, probably do it next day, because there's always something breaking right now. The big thing I wanted to get across outside this topic was what was happening in Essex County with the testing of the antibodies. Hey, Connie, what's your thoughts too?
For me, it really is just the unity. I've been getting a lot of nurses, administrators, doctors, civilians just reaching out to me on my website, which I didn't even know so many people knew. So it's ConnieAleen.com. I have a aspect on there where I provide just sort of mentorship and as much support and coaching as I could provide. And I think in many facilities where there isn't that cohesive relationship, I think with custody, you have civilians who are struggling to figure out the best ways to communicate, whether it's communicating what they've seen happened or communicating something about a patient. Yes, we're stuck in between the HIPAA, but we also know the importance of communication. Someone actually reached out to me and talked to me about the show we did where the officer was transporting an inmate, and she felt uncomfortable going home to breastfeed her kid after knowing that the inmate was COVID positive. It's like these things are happening and people are reaching out like, what do I do? How do I make sure that this doesn't happen? You've got nursing supervisors who are trying to make sure that they protect people. And I just have to say, we do these shows and people are watching and they're trying to figure out, how do I take this information back to my facility and make things happen? So for us that's on the panel, I think it's great. And just know that people be encouraged knowing that people are listening and they want to know, how can I do more? But I think it's also just knowing we're going to get through it. It's just being patient and trying to stay the course. And you know what, if worse comes to worse and you need to raise your hand because you've seen something or something's happening that might be contrary, you just got to sometimes stick your neck out and be your advocate, be your own advocate and participate, as Brian said.
Well said. Guys, before I close myself, I just want to tell people that it's good that we have this dialogue. It's good that we're honest with their perspectives, because sometimes you need to see both sides, because that's where you got to get to that middle, right? So you only get to the middle when there's two sides. And we touch on dialogue based on a constructive conversation that we're having, where we're not always going back to the same point. Our conversations are evolving and moving forward. You know, so as we have a discussion, Gangi starts with A, Greg hops in with B, Russ goes to C, E, and we just go around the alphabet to make sure that we cover what needs to be covered, but we do it progressively. And I think dialogue like this that we're having, we're ahead of the game. So for people that are watching this, you're getting very valuable information that doesn't just apply for what happened yesterday or what's happening now, but also in the weeks to come. You know, and with certain things that we're keeping track of, you know, with the things that we're trying to make sure that the information's out there. All we can do at this point is put the information out there, and if people are thirsty enough, they'll take it. If they're not, there's not much you can do. But the key is that we're playing our role. Our role is no different than we said before with letting the population know, letting staff know, is what have we learned and what can we share? And that's what we're doing right now. So again, guys, the show, the 2-hour dialogue we had today, it's for you guys. It's a way to appreciate what you guys are doing by giving you the information, but also at the end saying thank you, you know, because that's the end result. You know, thank you for what you do. Thank you for making the sacrifice. And again, the motivation to go through, that you're not alone, and that if any time you need something, you know, there's people to reach out to. You know, there's people that are here that are trying stuff, and we're trying to give you solutions. So let's hope people listen. But as always, guys, the show is Tear Talk. If you haven't, please subscribe, interact, engage, comment, hit that bell. That bell is going to notify you every time I post up a video. Real quick, before we sign off, I am so tired of doing this speech. So if you stayed long enough, I want to see people actually disconnect. Well, no one probably even hears me say that. They probably say, oh, it's over, and cut me off. But so not a lot of people are going to see this. But Russ, you've been on my show the most, and next time we'll do this with Connie. Russ, why don't you close off the show with everything I just said, and then you can end the show, and then I'll do the stop recording. Go ahead, Russ. End the show for me.
All right, everyone. Be advised that Tear Talk is dedicated to the brave men and women in the correctional field out there. So, I don't know, something about, you know, and, you know, do this other thing and something or the other, but make sure that whatever you do, that you subscribe, you hit that bell, and that's going to keep you notified every time we post new content out there. So anyway, it's the best I could do, getting, you know, put on the spot like that there, Anthony. Thanks.
I'm still waiting for you to close off. You haven't said goodbye.
Goodbye.
Done.